Saboba Medical Center. We are a 90-bed mission hospital under the auspices of the Assemblies of God Ghana Church, located in Saboba Northern Region, in a remote district which is very deprived. We are really looking forward to this computerization project because throughout our hospital we are struggling with enormous amounts of paperwork.
Ms. Edu Raymond, Health Services Administrator. We have a lot of problems in this hospital with regards to information. First of all, you can see around that we have a lot of folders from previous years, and we have challenges in how to retrieve these folders. There are a lot of questions that comes out. If someone has been here and he doesn't come out with the ID card, how do we retrieve his or her folder? It becomes a problem. So in advent of this particular system, I think it will help us a lot to resolve all these issues. Thank you.
My name is Saboba. I'm the biostatistician for Saboba Medical Center. We are in charge of recording records of patients who come to this hospital. We have problems with storage of folders, and it's creating a lot of inconvenience for us. We, as you can see in this room, we have records from the year 2007 up to date, and it has already occupied the medical records room.
The OPD number, then the tests or test to be carried out, then whether the person is MHO, that is National Health Insurance, then if it is not and he has paid the receipt number, then you sign. So this is the lab request form. So we write the name and all those things. These are the tests, the date, and this is the prescriber's signature. This is the OPD number, and this one tells us whether the patient is health insurance. Set for, then we put dash, then get their results and write it again. So we still have to enter the name of the patient and all those things, and then the results, the WIDA results. Yes. So based on our findings,
so it means very tedious.
It's tedious,
and it will take time to.
It takes a lot of time.
If we have this system, you just have to queue in and then you go.
Everything is done. And now we are lucky. In fact, we just complained this morning. I'm not supposed to be there.
Okay.
We are lacking of staff. We need staff urgently.
Okay. My name is Yalman Solomon. I'm the president assistant. So we will have to sit down and create this line ourselves, write all these headings ourselves, and also sit down and enter these drafts one after the other. So it means that if you have about 1,000 patients one day, we'll have to enter about 1,000 precision forms with several drafts on same precision form, one precision form. And this gives us a lot of work. If the computer is just by the counter, you bring your precision form and just type in there whatever information is there, and then dispense straight forward to the client, and the client goes away. And that will make the work very faster.
I'm a staff at Saboba Medical Center. Some of the difficulties we face here is sometimes the pressure on us based on the admissions and the discharging system. And sometimes due to the pressure, we don't write our report effectively. And our bedding system too has always become hectic for us. Sometimes we do write on the folders, which in actual sense is very bad and it's not in the best form, but all what we can do is that we are content to it because we don't have the facilities to maybe upgrade all the processes. We also, as a nurse, you have a report to write as patients come in. That so and so came in through the OPD with these complaints and diagnosis, so that when you are handing over to the next staff, then he can read and go through all these things, and then.
a ward assistant. Okay, I would say the minor problem we have be maybe keeping records. At the end of it, they come to pick what is there. We don't have any file here for it, but it would be good the ward should get one folder, a file for that, so that we can also file issue concerning the ward here. And we have our data response to keep here. When they pick what they need, we should also get some for ourselves here, so that we can go back for reference. Further reference. Maybe when the person is back for admission, you can go through the old cases. Sometimes some comes without bringing their old cards to get their new folders. So they give them new folders, and through the new folders, you can know what was diagnosed for the previous times.
Here is our major theater room. Here, a lot of surgeries are being done here. Manual work. As you can see, these books around, we write a lot. So we can see a lot of manual work being done. A lot of manual work being done here. And then we have another books around. On non-insured patients, when a patient comes in without insurance, then the person is aware that definitely whatever transpires over, he or she will have to pay. So that's why we have the cash office. So the billings are done at the cash office. When he goes to the consulting rooms and then they prescribe drugs for him or her, then he goes to the pharmacy for the drugs. There too, they also prepare their bills over there. So eventually the person will have to go back to the cash office and then pay all the bills as expected of him or her. So
we are very, very, very encouraged that IICD and Binks and the other cooperating groups such as CHAG are willing to select Saboba as a pilot site for this project.